Hello my friends, my name is Dr. Saeed Kazmi. Welcome to my channel, and today I'm going to talk about different methods of options appraisal. Those of you who have watched my first 4 lectures on the series Public Policy Making, they would have understood that what is a public policy, how do we do a stakeholder analysis, how power dynamics are used in the context of policy making, and what are some of the models that are used to make policies. And today we will dive a bit more deep into this subject, and we will be taking into consideration how different policy models they are weighed. So what are the methods by which different policy solutions they are compared to one another in order to see which is the best in a particular course of time and action. So before I start talking about that, for those of you who are watching my channel for the first time, please do subscribe to my channel and also press the bell notification icon, so whenever I upload a new video you get an instant notification. Apart from that, if you like my videos, please press the like button and also share it with your friends, and if you've got any question or comment or any queries, you can put it down in the comment section below. Fine, so let's talk about options appraisals. Now this is a scientific method by which different options, or when I talk about options, I simply means policy solutions. So looking at different policy solution options, how they are weighed to see which would be the best course of action in any given scenario. And most of the times we see that when we have got a problem, we have got more than one solutions to that. And obviously when we have got different solutions, then it's very important to weigh them to see which solution is the best. So how do we do that? Now there are 4 methods by which options are scientifically they are weighed with one another, and these 4 methods are: number 1, cost benefit analysis; number 2, cost effective analysis; and number 3, cost utility analysis; and number 4 is cost minimization analysis. Now I'll start with the 4th one because that's the simplest one, the cost minimization analysis. So cost minimization analysis is very simple. If you have got different policy solutions, you see which one is the cheapest. In other words, which solution you will have you have to apply least of the resources in terms of your financial resources, manpower resources, time resources. So whatever is cheapest to you, you just go for that. That is cost minimization. So you look for different options, the one which is the cheapest, you'll go for that. Now coming to the other 3, which are a bit more complex, they are the cost benefit, cost effectiveness analysis, and cost utility analysis. I'll start with the first one, which is cost benefit analysis. Now cost benefit analysis is basically an economic analysis, and they do it in the economic sector. When we talk about the health sector, usually it's very difficult to apply the cost benefit analysis, because in cost benefit analysis the costs and the benefits they are weighed. For any option you have got the cost, because any option that you're going to go for, that would cost so much. So it's going to cost some money, it's going to cost some human resources, it's going to cost some time, it's going to cost some information. So that always comes at a cost. Now at the same time, when you're doing that, you will get some benefits. The only caveat here is that these benefits they are translated into economic or monetary terms. So you will see, if I apply 10 pounds, how gonna benefit I'm gonna get by investing these 10 pounds. I'm gonna get 8 or 10 or 15 or 20. Now the problem is, in health sector you cannot always put a dollar or a pound amount on the benefits that you get, because most of the benefits are social benefits. Like people have, like if you apply some let's say some different types of course of actions in the healthcare sector, that might add to longevity of the people, that might save some lives. So it's very difficult to put up a dollar value or a pound value on, let's say, if a life is saved, how much that would cost in terms of pounds. It's very difficult to quantify human lives or the value added by saving lives. So cost benefit analysis, in very simple word, you look at the costs that would be incurred by when you are applying that solution, and what would be the benefits in monetary terms. So you can do it on an economic sector. If you are gonna, let's say you are establishing some industries, and let's say after 10 years that's going to give you some profit, let's say 25% profit. So you can quantify that in pounds or in dollars. but you can't quantify the benefits reaped in the healthcare sector. So again, very seldom used in the healthcare sector. That's cost benefit analysis. Number two is the cost effectiveness analysis. Now this is much more used in the health sector. So what is a cost effectiveness analysis? In simple words, again, on one hand, you look at the cost of the strategy that you're going to go for. Again, the costs are in terms of financial cost, human resource costs, time costs, and information costs. So you look at the cost of a given option that you're going to go for, and you also look at the cost of your current option. If you've got a current policy, you look what are the cost implications of that policy. Even sometimes if you are doing nothing, you don't have a policy per se, then what is the cost of doing nothing? So you look at the cost of doing nothing or your given strategy, and you look at the cost of the new strategy or the new policy solutions. Again, and costs are always quantified in terms of financial cost, human resource cost, time cost, and information cost. So you group the cost together, and at the same time you look at the effectiveness of the new strategy, the new policy, and you compare it with the effectiveness of the old policy, or if there is no policy, then what is the effectiveness of like doing nothing, and you try to compare that. And this effectiveness, again, we do not put a monetary value on the effectiveness. This effectiveness could be simply, you go for a new strategies, what would be the effectiveness? Let's say you say 1 million children immunized. It could be simply the numbers of lives saved by a new strategy, by a new drug, by a new intervention, which could be anything. It could be like making some new hospitals, starting new services. So what's that going to add in the social sector, or what's going to add in terms of the benefits given to the human life? As I told you earlier, that could be the number of lives saved, that could be the number of people treated, that could be the number of children immunized, so on and so forth. So you look at the effectiveness of, and I told you that effectiveness are measured in some of these terms. I've given you the example. So you look at the cost and you look at the effectiveness. So when you look at the effectiveness of one option and you compare it with the other one, you will see the differences. And the one that has got maximum effectiveness for the given cost, please keep it in mind, that does not mean that you would go for something which has got the least cost. It simply means all of your options could be quite expensive, but you will go for the one that is going to give you maximum effectiveness in terms of life saves or other thing. So if you've got 2 or 3 options, you will see which one is giving you maximum effectiveness among all the options that you are weighing together. So that is cost effectiveness analysis. So in very simple words, it is the effectiveness of a new policy, a new strategy, divided by the cost, and you subtract it by the effectiveness divided by the cost of an old strategy, or if there is no strategy or no policy, that will be simply the effectiveness and the cost of doing nothing. Obviously that would be 0. So if you've got 10 minus 0 would be 10. So obviously you will go for the new one. So again, to summarize it, cost effectiveness analysis is the economic analysis in which you look at the costs of a new solution, a new strategy, and you also look at the effectiveness, and this effectiveness is in terms of numbers of lives saved. It could be in the numbers of children immunized, it could be in the numbers of treatments given to people, so on and so forth. And you would compare it with the effectiveness and cost of an already present option or strategy or policy, whatever name you want to give it to. So I hope that is clear to you. The only one thing with cost effectiveness analysis is that when you are weighing different options, you cannot compare apples with oranges. For example, if you are, let's say, trying to weigh different options, let's say you are analyzing options for mental health services, then you will only take different options like policy options for mental health services. You can't like compare mental health service with let's say women health service, because they are altogether different things. So you cannot compare effectiveness of 2 different things. You have to take different options which belong to the same context. So this is one of the limitations of cost effectiveness analysis, that you have to take similar programs, similar options to weigh and look at which one gives you the maximum effectiveness for a given cost. That should be clear. Now, if we have to compare apples with oranges, and that comes many times at the higher policy level, especially when you are in a resource constrained environment. So let's say if you are in a resource constrained environment, so you're already you've got financial constraints, let's say, so every pound, every penny, every dollar, you want maximum return for that. So the question is, should you invest in geriatrics? Should you invest in newborn and child health? Should you invest in adult health? Where should you invest? Because investment in all these different things are going to give you different benefits, different effects. So again and again, these are different ball games. Geriatrics is quite different from adult, which is quite different from, let's say, newborn and child health. So how should you compare different policy strategies when they are focused on different domains? For that, we have got cost utility analysis. And cost utility analysis simply looks at the utility of your new policy, new strategy, new options, and compares it with the utility of your old option or whatever other option you are considering. So let's say if you've got 3 different programs, one focusing on the newborns, one focusing on the adults, one focusing on the geriatrics. So for all these 3, you would look at the cost and you will also look at the utility. And this is quite interesting. When we talk about utility, the one single unit to assess utility in the health sector is disability adjusted life years, DALYs, disability adjusted life years. And that is a combination of years of life lost due to premature mortality plus years of life lost due to disability because of that particular condition that you are taking into consideration. And that is important because it also gives some weightage. It's a disability weightage. So somebody who is, let's say, who becomes a quadriplegic because of any problem, so he has got severe disability, he is not able to do so, his disability weightage is more as compared to somebody who is just bedridden for 2 and 3 days and then is back to normal and can do anything. So again, disability weightage of like severe injuries like spinal cord injuries would be more than somebody who's just got a broken toe or a broken finger. Similarly, the age discounting is also done in disability adjusted life years. So somebody who gets a problem at the end of the life, like for example in UK, the average life expectancy at birth is 81 years. So somebody who develops a problem at 79 years of age and dies, he has only lost 2 years of his life, his expected life. But somebody who dies at 1 year of age, he lost 80 years of his life. So the age discounting is done. So in disability adjusted life years, somebody who let's say loses 80 years of his expected life is more important as someone who loses just 2 years at the end of his life. So that's why age discounting and all these things is done in disability adjusted life years. So disability adjusted life years is the years of life lost due to premature mortality, which is again the number of cases which have, let's say, died because of a reason multiplied by the number of years which they were supposed to live at the time of their death, or in other words, that is simply life expectancy at the time of death. So like 10 people died at the age of 30 years. So 10 is the number of cases and the age 30. So if the life expectancy at the time of death, let's say 30 years would be, let's say 81 minus 30 would be 51 years. So what you will do is 51 multiplied by 10 would be 510 years of cumulative life years lost due to premature mortality, which is a big number. And just imagine when you have got things in thousands or millions, you can just do the maths and you will get an idea. And at the same time, years of life lost due to disability. So those people who have not died but have become disabled for one reason or the other. How much is the degree of disability? Somebody who develops a quadriplegia in a road traffic accident is paralyzed for the rest of his life. So his years of life lost are much more as compared to somebody who's hospitalized just for 1 month or 2 months, but then either he's absolutely fine or he dies, but in any case, there's no more disability. So they would have less weightage. So in that case, if you've got different program, let's say newborn and child health, and you've got geriatrics, so definitely if you do the maths, you will see that disability adjusted life years of a problem that affects newborns or children would be much more higher as compared to those that affects geriatrics. So that gives you an idea that you need to invest in, let's say, newborn and child health care. Why? Because the disability adjusted life years for that would come out to be huge as compared to a problem which is affecting the other extreme of life. So the World Bank and the World Health Organization since 1993 are advocating the use of disability adjusted life years to calculate the burden of disease. And the burden of disease, like previously we used to calculate it in terms of incidence and prevalence for morbidity and different types of mortality indicators to take into account the mortality. But now they are advocating to use a single composite indicator for morbidity as well as mortality, and that is disability adjusted life years. So the utility of a strategy, of a policy, or of a course of action in the healthcare sector can be very much determined by disability adjusted life years of that particular problem that you are taking into consideration. So you will look at the costs, the cost implication of that policy, and you will also look at the disability adjusted life years which you would save. So in other words, you would see disability adjusted life years saved by your new strategy, and you compare it with the cost and the disability adjusted life years of the old policy or the second option or the third option, and you compare that and you say, okay, well, fine, for this much amount my option A is saving more disability adjusted life years as compared to option B, so I'm going to go for option A, and that would become my policy tool, or that would become my policy option. So that is how a cost utility analysis is done for different options in the healthcare sector. So this was a brief overview of the different methods for option appraisal at the higher policy level. We use different economic tools, and I told you that there are 4 methods: cost minimization, cost benefit analysis, cost utility analysis, and cost effectiveness analysis. Remember, cost minimization is very simply which option is the cheapest. Cost benefit analysis, we don't use it anymore in the healthcare sectors because of the various problems associated with that. Cost effectiveness analysis is used when you are weighing different options related to the same problem, and cost utility analysis is used when you are trying to make options for different programs because you've got different priorities and you want to see which should actually be on your list, which should be solved first. For that you have to do a cost utility analysis, and as I told you, for that the unit is disability adjusted life years. So this was in a very in a nutshell, just to give you an idea what are the different types of options appraisal methods. We also call it economic appraisal of different options. If you have understood, well and good. If you have not understood, you could put down your questions in the comment section below, and I will come back and try to simplify things for you. So thank you very much. Have a good day, and bye bye.